an 8-year-old male, sickle cell disease, splenectomy, received vaccines against strep pneumo, Haemophilus influenza type B, and Neisseria. His father asks whether he is still at risk of sepsis, which organism is the most common cause of bacteremia in such patients. Here we first see splenectomy. That's why he is vaccinated against these organisms, called encapsulated organisms. Also, patients take penicillin twice daily until they reach 5 years. We may also expect whole jelly bodies on peripheral blood smear, but the question here asks about the risk of bacteremia despite vaccination. So the answer here is gonna be one of these, or no, he's not at risk. In our case here, the patient is actually at risk, and there are many examples like so. So here choice D is incorrect, because despite vaccinations, the patient is still at risk. So the answer is gonna be one of these choices. And likewise, we might get a pertussis question about someone with cough and vomits after coughing. And the vignette mentions that he took the DPT vaccine. Then you might say, oh no, so what is this? Still, this patient has pertussis. The question gave you the password, severe cough and vomiting after coughing. It's over. Because you should know that vaccines may fade over time. That's why people take boosters. Also meningitis. The vignette might say the patient is vaccinated but exposed to someone with the infection. So do you give prophylaxis? Remember that you give it regardless of the vaccination status. Like in pertussis where we give azithromycin or rifampin or ceftriaxone in case of Neisseria. So you should always remember that you give it regardless of the vaccination status. So now back to our question where the patient had splenectomy. And that raises the risk for the 3 organisms listed in the choices. But you should always know that the most common one is strep pneumo, which is the answer here. And here are our side notes which I recommend you to read.